So Laura, welcome to this series for leaders at Emory Healthcare. Laura, you're a new face and participant in this transformation going on at Emory Healthcare today. Tell us about yourself, tell us how long you've been at Emory, and I know you've also been involved in healthcare in the past.
So I came to Emory about 4 years ago, EVP for the Business Affairs Office, with a primary focus on healthcare. Most recently in my past, I was at Kaiser Permanente for about 7 or 8 years, where I worked in both the medical group and the health plan,
Nice.
both times in the care delivery space. I developed an analytic function for the health plan.
What was it about your background that led you to this space of analytics? Were you in college kind of an analytics and data person?
Well, no. In college, I majored in accounting. I actually wanted to major in art history. My mother shifted me over to something more practical. But when I graduated, I didn't want to be an accountant. So I went directly to grad school, and I got a graduate degree in healthcare administration.
Oh, nice.
My first job out of grad school, after I did an administrative residency, was as a decision support analyst. And that was my first exposure to really doing data analytics.
I see.
And I never really stopped. So I went from decision support into more budget roles, but I always kind of took with that an analytic lens. And I
see.
think that when you're doing the budget, when you're doing financial planning, you need to understand the organization, at a very at a granular level.
Right.
You need to understand the operations. And analytics, opens all of that up for you.
Yeah. And so what have been your initial observations about Emory Healthcare and some of the data and the analytics that you're able to see?
My first impressions of Emory Healthcare is an incredible organization, and it does incredible work. But when you get into some of the finance and data and analytics, we're really light.
Light in terms of expertise or understanding of the data?
Well, a little bit of everything, actually. There's a lot of data out there. That's the way I like to think about it. There's a lot of data, but there's not as much information, right? And then when you look at the finance team in particular, you have a handful of people who really do analytics, but they're the only people who do.
Right.
And so they don't have the bandwidth or the scale to really do the work that is required of them. And so we don't have a good answer sometimes on just why are we doing things the way we're doing, where are the problems, how are we performing in our efforts to improve. If you can't measure it, you can't improve it.
Sure. But I suspect, Laura, that this is not an uncommon problem.
Oh, no.
That is, healthcare systems, which are incredibly complex. I mean, Emory Healthcare, we have just under 1 million patients that we see every year. We have 30-some thousand employees, 11 hospitals. I mean, we're a busy place. And as you can imagine, we collect data on what is somebody's blood pressure every day, all the way to our accounting and finances. I mean, data is everywhere, and making sense of that data, one, we can measure it, but we also have to make sense of it. It's probably not uncommon that healthcare systems today are kind of lost
in all of the data. Right. But at the same time, it just provides so much opportunity for what we can do.
Right.
And you can then build it and design what we need. So right now we have this blank slate, right?
Right.
Or blank canvas, and Alistair's going to be doing all of this work with the data, and it gives us the opportunity to get in there and work with Alistair from the beginning to say this is how we want to define this, or this is how we want to look at that, and then really start to try to bring the whole kind of data community together.
Right.
To
I hope that's exciting.
Oh, it's absolutely exciting.
What do you think we should be telling our employees who will be viewing this about where are we heading with regards to our finances?
Well, as we move forward, I think that one of the more critical pieces is really getting our arms around the data again, right? And so that's what I'm looking forward to doing is, getting in and trying to understand, as you mentioned, the wealth of data that we have,
Right.
and turn that into something that is meaningful so that we can move forward and make some real change. Areas that we need to focus on, things like labor. Our labor spend is really, really high, but it's high everywhere.
Sure.
And contract labor is still a challenge. And we need to make sure that as we focus on these areas, that we do so smartly, and that that we don't sacrifice quality, we don't sacrifice clinical care. We ensure that our staff is able to do their jobs effectively and safely.
Right.
We need to be able to measure our performance as we go. And we need to be able to do so at some level of granularity so that we can identify pain points. We can course correct as we move forward.
Yeah, because the last thing I would imagine we want to do is implement something and then not know if it's working until sort of the very end.
And we also need to think long term. We can't just look at what is going to happen this year, so that we can incorporate that into our overall financial planning process.
With respect to our finances, as we continue to deliver that excellent care, we obviously have to have the finances to execute on our mission. What are we looking at moving forward?
So what we want to be able to do is we want to be able to build and develop sustainable improvements over time. So we're looking at, maybe a 3-year window to really get us to sustained improvement.
Yeah.
But if we want to build up that balance sheet, we really are probably looking for maybe sustained improvement over 5 to 7 years.
Do you think we'll get a sense over the next year or two that gives you confidence that we're heading in the right direction?
Yes, I do. I think that we've already seen some improvement over the last, few months, and I do believe that we can develop the ability to course correct.
Yeah.
And we'll be able to see the improvement more quickly.
Good. And I'm glad that the employees of Emory Healthcare get a chance to meet just an exceptional leader like yourself.
Thank you. Thank you
Good.
very much.
Cheers.